Well, it's time for me to share one of my pet peeves in the caregiving world, and this is for taking care of an incontinent patient. It seems really even amazing that I have to share this or even have a pet peeve about it because I can't really understand how a competent caregiver would honestly do this to a bed-bound patient. And I'm talking about changing the absorbent brief, whether urine or stool, but leaving the patient in wet clothing. So we know caregivers should be checking the patient's brief about every 4 hours to be able to keep the patient clean and comfortable and protect the skin. But what about actually checking the patient's clothing? Clothing is absorbent, and if the patient has any urine or stool leak out of the brief, it can easily be absorbed by the pajama top or bottoms. So do I even need to say it? But please check the patient's clothing and change it if it's wet from a leaking brief. I have to say this because I just entered a patient's room today, and in assessing her, I found the brief to be dry. In fact, it was even initialed by the staff member with the time, which is fabulous. So I knew when it was changed, but then I turned her on her side and both her pajama bottoms and top were wet. I mean, all the way up to her shoulders. Believe it or not, last month I even went in to see a patient who had had a towel and a blanket layered over the wet linens. So instead of changing the patient in the linens, they just put another dry layer on top. The odor of stale urine was so evident the moment I walked into the room. This is just unacceptable. So please, caregivers, there's no excuse for cutting corners when we're talking about patient personal care. If the bed's wet, you gotta change the linens. If the clothing is wet, you gotta change the clothing. And freshen the patient with a simple bed bath as you go along too. I'm Nancy, one of the care queens with the Hospice Care Plan, reminding you of our motto, care is treatment. Get our booklet and learn all about how to take care of your patient at the bedside. Watch our videos, ask us questions and comments. We want to support you.